Welcome everyone, and thank you for joining us today. I'm Teresa Marinette, CEO of the Windsor-Essex County Health Unit. I will start with our daily updates. We now have 1,471 confirmed cases of COVID-19 in Canada and 425 cases in Ontario. Chatham-Kent has 2 cases. The state of Michigan now has 1,035 cases with 325 cases in Detroit. To date, we have 2 confirmed cases of COVID-19 in Windsor-Essex County. Overall, 383 individuals have been tested for COVID-19, and of those tested, 264 tests are pending. These numbers reflect the total amount of testing done in our community, including Windsor Regional Hospital's COVID-19 Assessment Center at Ouellette campus. Test results continue to take up to 7 days. Please continue to visit WECHU.org for the most current information. As families return from March break, we want to remind you that any travel outside of Canada requires a 14-day self-isolation period from the day they arrive back in Ontario. Self-isolation means staying home, not going to public places, and avoiding contact with others. If you have traveled outside of Canada and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options available. Complete the online self-assessment available at ontario.ca, contact Telehealth Ontario, call your primary healthcare provider for a phone assessment or a virtual assessment if available. They will guide you for next steps, including contacting public health or attending an assessment center. Only people with COVID-19 symptoms will be tested. The criteria for testing is a person who has fever or cough and any of the following within 14 days prior to the onset of illness. Travel outside of Canada, a close contact with a confirmed or probable case, close contact with a person with acute respiratory illness who has been to an impacted area. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. As we promised to the community that we will immediately notify all confirmed cases of COVID-19 in our region, we reported those 2 cases of COVID-19 in our community. I would like to let the community know that both the cases are recovering well in their homes and are in self-isolation. All the close contacts of these cases are identified and are following the public health measure of self-isolation as per public health case and contact management guidelines. As mentioned earlier, today is the first day after March break, and many of the area residents have just either arrived or arriving in the next few days. It is absolutely important for these returning travelers to self-isolate themselves to protect their own family and also protect the entire community. We are in this together. We all have a role to play. Please play your role in the protection and well-being of your community. Self-isolation means you do not go to work, you do not go outside your home, you do not go for groceries, you do not have any visitor inside your home. Anyone who is self-isolating and is concerned about groceries and supplies, please look at the options available for home delivery or have your friend and family deliver that to your door without letting them in. If you are someone who is crossing the border to pick up your family returning from a trip, please ensure that you strictly follow the social distancing part. You do not get in close contact even with the people that you're picking up. If you are a caregiver in your house and someone else is self-isolating, please ensure that you do not share the same utensil, you do not share the same room, you do not get in close contact with each other. If all of these are not possible, please consider self-isolating yourself too in the better interest of the community. For more details on social distancing, self-isolation, self-monitoring, and caring for those who are self-isolating, please visit our website www.wechu.org under How to Protect Yourself section. We have a number of long-term care homes and retirement homes in our region. There are frail and elderly people in these facilities. We have learned from our other jurisdictions, especially Italy, that the fatality rate for COVID-19 is very high in that population. There are strict ministry guidelines on visitation, transfers, and self-monitoring. We must recognize that the residents in these facilities are vulnerable, and we should avoid visiting them to protect them and the other residents of the facilities. This could be a challenge. You want to stay connected with your loved ones. You should explore options for talking to them, video conferencing them with them for their health and well-being, maybe several times a day. As hard as it may be, but it is in their best interest, and we should act in their best interest of our loved ones. Staff who are working in these facilities, you have the most important role. Please follow the organizational policies, especially related to self-monitoring and taking appropriate precautions, such as hand washing, not transferring items from one patient to another, and using appropriate personal protective equipment to minimize the spread of the disease in the facility. The same goes for healthcare workers working in any acute care hospital. Please follow the organizational policies and continue to take appropriate precautions, including the use of personal protective equipment. Healthcare workers who are going across the border should remember there is a widespread community transmission happening in Michigan. You must follow social distancing measures as much as possible. Do not interact with anyone other than the people that you must contact with, but still maintaining social distancing as much as possible. When you are back in Canada, please do not go out in the community and stay home as much as possible. Monitor your symptoms daily, preferably using a thermometer. It is in your best interest to protect your own health, protect your family, and protect the community. The City of Windsor and County of Essex has declared a state of emergency, and we will continue to work closely with them to ensure the safety and well-being of our community and prevent the spread of COVID-19 in our community. Employers in the community, please look for work from home options as much as possible. If work from home is not an option, please ensure that social distancing is maintained at your workplace. Environmental cleaning of shared workspace, doorknobs, handrails, and any other equipment is properly cleaned to ensure the safety and well-being of your staff, your workplace, and in the community. All of us are in this together, and we must work together to prevent the spread of COVID-19 in our community. Once again, we are reminding everyone, including our returning travelers coming back from March break, who are self-isolating, should not go to work. Everyone should practice social distancing. Wash hands with soap and water thoroughly and often, as many times possible. Cough or sneeze into your sleeves or a tissue. Keep surfaces clean and disinfected, and most importantly, do not go outside if you don't have to. Thank you.
So we'll now take questions from the media. Let's start with CTV.
So you referenced the threat in Michigan. Michigan Governor Gretchen Whitmer, I think that later this morning is going to announce a stay-at-home order. That's a recommendation in Windsor right now. What would it take for that to become an order?
So we are assessing the risk to our community very closely, and given that the cases that we have in our community are well contained and they follow all the self-isolation measures, we do not have a widespread community transmission at this stage. We just have 2 cases. But if that changes, if the risk assessment changes, we will be considering doing that. We're already reminding residents to do not go outside if you don't have to. Have your emergency supplies ready so that you don't have to go to the grocery shops every day. Delay as much as you can. Maybe go there after 3-4 days, not every day. Some grocery stores and stores are taking initiative in allowing seniors and high-risk population and only at a specific time. So those are all the measures in place. We're looking at closing all the non-essential services and non-essential businesses as well to protect our community. So all of those measures are happening right now. We haven't gone to that point yet, but we are actively monitoring, and if needs to, we will do it.
If I can follow up on that as well, Blake. You referenced 1,000 cases in Michigan, over 300 in Detroit alone. Why aren't we seeing more cases in Windsor with that just not next door? Is that the concern for the health unit? Is that we might see some spillover?
Well, that is our concern, that we may see some cross-border workers or people who are traveling and bring this COVID-19 in our community. And we are working with our provincial partners and federal partners to make some good, strong actions to prevent this from happening in our community. We are definitely concerned. We want to make sure that we do the right thing for protecting our community, but some of these some of these actions requires multiple level of government's approval, so we are working with them.
And
Oh, We Digital?
Sure.
Yeah, the test results, any progress on London getting the facility to do test results, and how long is that gonna take, or is there a process on that?
So what we have heard is the London lab should be able to receive specimens starting today. I haven't seen any official document to state that, but I'm hoping that once they start to test the results in London, we should see the results back within 1 to 2 days. So we're hoping that should clear up some of those backlogs, but there has been a widespread push from the ministry to ship these testing to regional centers, and that would be beneficial to get the test results back quickly.
Any questions from CBC?
Yes, absolutely. I have a question about how many cases, like what percentage of total cases are asymptomatic?
So at this point, there are a number of people who are self-isolating, and one of the criteria that we are using for testing is the symptomatic and the travel piece, with some caveat and some discretion at the clinicians to make the call of testing someone. Anyone who is hospitalized sick with acute symptoms or acute respiratory failure, they're all tested as well, but the majority of the people who are currently being tested are symptomatic.
Okay, and is there any, I know you get this question all the time, but is there more of a conversation about expanding the criteria for getting a test at this time?
So we are limited by our ability to test the specimens at this time. In an ideal world, yeah, we'd like to test as much as possible. And given that challenge, we are trying to utilize our resources in the best way possible to allow the test centers to assess those individuals who really need to be tested, more specifically people who are really, really sick and people who have symptoms and who meet the criteria for testing. The 2 cases in our community, they were all both symptomatic. They had reason that they had contact with confirmed cases and with the travel. So all those are pointing to the fact that is still continues to be the main issue in our community, travel related. And so we are making sure that we have all those measures in place to prevent and limit the spread from that perspective. If there's any indication of community transmission, then it would make us do more testing. But in any case, from a public health perspective, I think what we have been doing in the last few weeks is to implement some of the public health measures that are essential for limiting the spread of the disease. Even by assumption, let's say if we have asymptomatic cases or asymptomatic people who are spreading the disease in the community, our advice is stay home. Don't go outside if you don't have to. Follow social distancing. Wash your hands frequently. If you are sick, don't go home. Isolate yourself. So those are the messages that will still be the most effective way to control and limit the spread of the disease. And we want to make sure that the community understand that. People who are returning, they understand that. What does social isolation mean? Social isolation means you do not go to work, you do not go outside, you do not go to groceries, you do not let anyone come inside your house. We must follow all these recommendations to ensure the safety and well-being of our community.
Any questions?
In terms of medical work, sorry. May I jump in with another one?
Sure.
In terms of medical staff who are coming back from the United States, so if they travel for non-essential reasons, they still must self-isolate. I guess I'm just wondering what the hospital is doing to reinforce that or to enforce that if they are coming back from March break to make sure that they are quarantining and not working.
So the hospitals are, obviously they have their own organizational policies, but we are working closely with them to make sure that they understand the risks of individuals who are coming back and potentially be needed as if they are deemed essential worker to meet the operations of the hospital. There is a system we're trying to put in place to do a formal risk assessment on each of these cases individually and try to figure out what we can do to minimize the spread if they are the carrier or if they are bringing the disease. We want to make sure that all the appropriate actions are in place to give them an opportunity to maybe work in a different setting, maybe work in a different ward, maybe work with the population who may not be as sick and frail as maybe in some of the other wards. Maybe temporarily look for reassignments. Maybe looking for making them work in shifts that are not as busy as some of the other shifts are. And if they still working, what they can do to protect the patient population, wearing a mask, using gowns and everything, like wearing a mask all the time. So even when they are going, are they monitoring their symptoms daily? Like, and not by monitoring, maybe including also taking daily temperatures to ensure that we're not missing anything out. So all those conversations and all those risk assessments has been currently worked out with the hospital to ensure the safety and well-being of our community and also for the healthcare worker. But this is an issue that we will have to continue to revisit and see what are the threats level and what else we can do more to protect our community and also our vulnerable in the hospital.
Are there any questions from AM 800 or?
Go ahead.
Yeah, AM 800, Blackburn, Windsor Star, Windsorite.ca. Okay, CBC.
Thank you. I'm just wondering about personal protective equipment in hospitals. Right now, I know that there's been sort of a call for people have supplies that they can offer to medical workers to step up. I guess I'm just wondering what that status is right now in our hospitals.
So I think the hospitals can speak better to it. What we heard is they do have a pandemic supply for all these personal protective equipment. They've started using that supply. The supply of personal protective equipment is, there's a global shortage everywhere. But they do have enough supply to last them for some time. The ministry is actively working to bring those supplies to the hospitals, to healthcare partners, to everywhere wherever it's needed, including the gowns, gloves, and masks, and hand sanitizer or whatever they need. So the ministry is actively working on to ensure the smooth supply of these equipments and PPEs to the health system partners. So they are actively working on it.
Question from CTV.
So just to circle back to the London lab question, if the idea is that we're going to be able to get tests back in 1 to 2 days as opposed to 7, does that mean more people will be able to get tested, or does that not change that end of it?
Well, I guess we still have to be responsible in terms of who should be prioritized for testing. So if I am a healthy individual and if I'm just concerned if I want to be tested, probably not. If I am sick and if it is something that I haven't experienced before, maybe some of those individuals may be considered. But I think the key still is the people who are sick in our community, people who are in long-term care homes, people who are hospitalized, people who need any kind of acute care, again, ICU type beds, they would be the first priority. Healthcare workers, if they are developing their symptoms, they would be the high priority. So we have to create some criteria in who should be tested in what capacity. Any kind of mass testing, if it's not indicated, it gives us a false sense of security. It raises the question of false positivity, false negativity. So we have to be careful in who we are ordering those tests for. But clearly, having more tests available for people who are sick, that is the first thing that we want to do.
And so just to make sure I'm super clear, the testing in London, that is essential. That's just to ensure that we're getting those results back faster.
That is correct at this point, yes. But some of these guidelines are coming from the ministry as well, that how these triaging is happening and who should be tested. Some of those are coming directly from the ministry.
And so,
Any more? CTV?
Yeah, I have another question, if that's okay, and forgive me for Carter, you already asked this, I missed part of your question at the beginning of the question opening, but just in terms of social distancing rules at places like grocery stores and things like that, we know in Vancouver, they're implementing fines for businesses who are not enforcing the 2-meter social distancing. Is that something that is under consideration for Windsor-Essex?
Obviously, we are assessing the risk and threats in our community. I think we have seen some good positive responses from many of the grocery stores by providing a limited number of guests or shoppers in their facility and following the social distancing measures as much as possible. So we have seen some good progress in that. If it continues to become a problem, we will reassess that. But I think as a social society, as a community, we all need to recognize our role and continue to play our role in preventing and limiting the spread of COVID-19. And if the threat continues and if people are not following it, we can definitely look into enforcing it.
So,
And just lastly, the construction sites are still open. I guess I'm wondering if that is something that you're looking at potentially ordering to close at this moment in time, or is that considered an essential service?
Well, we are assessing the risks to all of these workplaces on an ongoing basis, and as I recommended earlier, people whose services are not important at this time, are not essential, they should consider closing down their businesses voluntarily. We are assessing the risk of if this business continue, how it's going to impact the community in general. So we are making some of those decisions based on that, and it is a good opportunity to continue to revisit the risk to the community, and some of those decisions will happen if the risk to the community changes.
Thank you very much.
Yeah, one more. Again, just to kind of follow up on the first question in regards to Michigan, I know you said you guys are monitoring the situation. Obviously, the recommendation, the messaging from all health officials have been stay home as much as you can. I guess the question, why not just take that step and say, this is an order, there are penalties attached, you need to stay home. You know, you've done it for businesses and other things, you know, I guess why not take this step now as opposed to waiting for, I don't know, some other measure, some other measure?
You're referring specifically to healthcare workers who are crossing the border?
No, in terms of, so Michigan is going to institute a stay-at-home order, maybe another term for lockdown. I guess why not in Windsor? If the recommendation is already to stay home, to self-isolate, to not go out, etc.
Good question, and I think we really have to look at our risk to the community and our role. Obviously, that is possible, but it is also infringing the rights of every individual and ordering them to stay home. We have to have that level of credible risk to make that call. If someone from a higher level of government make that decision for us, easy, but for us, in order to say that we are moving in that direction, we may have to. But at this point, we don't think that this is necessary, because if obviously, as I said, it puts many individual rights at stake, and we do not make any of these decisions for closures lightly. We do a good risk assessment, and when we come to a conclusion that this is a risk, we make that decision. So far we haven't seen that this is the case, but in the future, if it needs, we will do that.
The last question, if I can, when you had ordered the retail shops, tattoo salons, whatever, I got a question on Twitter. Are convenience stores covered in that? That I thought was a gray area, but maybe grocery. Like, what's the recommendation on that?
So convenience store, we did talk about that convenience store piece. Many of these convenience stores is accessed by individuals who don't want to go to the grocery stores, and it's right around the corner. And they are providing essential products such as milk, bread, and eggs. So I think it is important for them to continue to have that ability to access that. But we want to make sure that, you know, all these businesses, they understand the risk and they are following all of those criteria, such as limiting the number of people inside the store, depending on the size of their store, and following all those good practices of cleaning and ensuring the common type services. Thank you.